Central nervous system drugs. Hello everyone, welcome to Nursing in Me. My name is Eden, and I'm one of the new team here at Nursing in Me. I'm thrilled you're joining us because today we're venturing into the fascinating world of central nervous system drugs. In this video, we'll cover everything from benzodiazepines and antidepressants to mood stabilizers and anti-epileptics, giving you a clear understanding of each class and why they matter. Benzodiazepines. Benzodiazepines are central nervous system depressants that enhance the inhibitory neurotransmitter GABA, thereby calming the brain. In this class, we have lorazepam, diazepam, alprazolam, and temozepam. These drugs are widely used for anxiety, panic attacks, sedation, and even acute seizure control. They can cause sedation, hypotension, and potential respiratory depression if combined with other depressants. And they carry a risk of dependence or addiction. It's crucial to taper these medications instead of stopping them abruptly, to avoid withdrawal symptoms. If a benzodiazepine overdose occurs, the antidote is flumazenil. Non-benzodiazepine hypnotics. Non-benzodiazepine hypnotics, such as zolpidem, also promote CNS depression and sedation, though they have a different chemical structure than benzodiazepines. Typically prescribed for insomnia, they can cause daytime drowsiness, hypotension, and dizziness. They're best taken at bedtime and should not be combined with other CNS depressants like alcohol. As with benzodiazepines, do not stop abruptly to avoid rebound insomnia. Muscle relaxants. Muscle relaxants act within the central nervous system to reduce muscle spasms or spasticity. Two common examples are cyclobenzaprine and baclofen. These medications help treat acute muscle spasms and chronic spasticity in conditions like multiple sclerosis. Adverse effects include sedation, dizziness, hypotension, constipation, and possible GI upset. They should be tapered rather than stopped abruptly, and patients are advised to rise slowly to avoid falls from low blood pressure. Combining them with other CNS depressants can increase sedation. Antidepressants, general principles. Before diving into specific classes, keep in mind that all antidepressants generally take 4 to 6 weeks to produce their full effect. They can increase the risk of suicidal ideation, particularly early in therapy or when doses are changed. Patients should never discontinue them abruptly to avoid withdrawal symptoms. Use caution with St. John's wort, which can lead to dangerous interactions, especially serotonin syndrome. Other common side effects across many antidepressants include hypotension, sexual dysfunction, and potential weight gain. Tricyclic antidepressants, TCAs. TCAs, such as amitriptyline, nortriptyline, and imipramine, increase serotonin and norepinephrine by inhibiting their reuptake. They're indicated for depression, OCD, migraine prevention, and sometimes chronic pain. Anticholinergic effects are notable here, causing dry mouth, blurred vision, constipation, and urinary retention. Sedation and orthostatic hypotension are also common. Overdose can lead to seizures and life-threatening dysrhythmias, so it's critical to monitor for any signs of toxicity. Patients should be advised to get up slowly to prevent dizziness from hypotension and to avoid abruptly discontinuing the medication. Monoamine oxidase inhibitors, MAOIs. MAOIs, such as phenelzine and isocarboxazide, work by inhibiting the monoamine oxidase enzyme, which increases dopamine, serotonin, and norepinephrine. They're often used for treatment-resistant depression and some cases of bipolar disorder, but require strict dietary restrictions to avoid tyramine, found in foods like aged cheese and red wine. Eating high tyramine foods while on MAOIs can precipitate a hypertensive crisis, so patients must be careful. They must also observe a 2-week washout before starting or stopping other antidepressants. Common adverse effects include hypotension, sexual dysfunction, and the ever-present risk of suicidal ideation. SSRIs, selective serotonin reuptake inhibitors. SSRIs function by blocking the reuptake of serotonin, thus elevating its levels in the brain. Examples include citalopram, escitalopram, sertraline, fluoxetine, and paroxetine. Indicated for depression, anxiety, OCD, bipolar disorder, adjunct, and eating disorders, they can cause sexual dysfunction, weight gain, insomnia, and suicidal ideation. Patients should be cautious of serotonin syndrome, which presents with fever, agitation, tremor, and excessive sweating. Always taper SSRIs when discontinuing. SNRIs, serotonin norepinephrine reuptake inhibitors. SNRIs block the reuptake of both serotonin and norepinephrine, thus boosting levels of these neurotransmitters. Examples include venlafaxine and duloxetine, used to manage depression, anxiety, and in some cases neuropathic pain. Adverse effects resemble those of SSRIs, such as suicidal ideation, possible weight gain, insomnia, and the threat of serotonin syndrome if combined with other serotonergic agents. Patients should also avoid abrupt discontinuation. Miscellaneous antidepressants. Some antidepressants don't fit well in the TCA, MOAs, SSRI, or SNRI categories. Two examples are bupropion, which can treat depression and help with smoking cessation but may lower the seizure threshold, making it risky for individuals with a history of seizures. Trazodone, frequently prescribed for depression or insomnia thanks to its sedating properties, though it can cause hypotension and, in rare instances, seizures. Mood stabilizer. Lithium. Lithium is key for controlling bipolar disorder, both for maintenance and in acute mania. Its therapeutic range is 0.6 to 1.2 MEq/L for maintenance and 1.0 to 1.5 MEq/L in acute mania. Levels exceeding 1.5 MEq/L signal toxicity, which can present as nausea, vomiting, diarrhea, ataxia, uncoordinated movements, blurred vision, confusion, or tremors. Maintaining stable sodium intake and hydration is critical because dehydration or low sodium levels can cause lithium to accumulate, leading to toxicity. Kidney function must be monitored since lithium is excreted by the kidneys. Thank you so much for watching this comprehensive review of central nervous system medications. If you found this information helpful, please consider subscribing, sharing, and leaving a comment. Stay tuned for more pharmacology insights, and remember to always keep learning. Until next time, take care, and I'll see you in the next video.